Welcome to the deep dive. Today we're doing just that, diving into source material about something you might have seen yourself. Polyphagia.
Right, that's the medical term for when animals eat excessively.
Exactly. And we've been looking through a veterinary reference, pulling out the key details specifically for you.
Yeah, our aim here is to help you understand what's really going on when a pet seems, well, constantly hungry. It's more than just noticing they eat a lot.
We want to dig into the why, right? The complex reasons the sources talk about, what it might signal, and how vets figure it out and manage it.
Precisely, drawing on the details in those sources.
Okay, so let's unpack this. The source material, it defines polyphagia pretty simply, just increased food intake. But the interesting part, the real story, is why it happens.
Oh, absolutely.
Yeah.
The sources get into the pathophysiology, the core mechanics behind it, and it's definitely not just one single thing.
So what are some of those core reasons?
Well, one major pathway the sources describe is when the body isn't actually absorbing or using the nutrients properly, even though the pet is eating.
Ah, so food goes in but doesn't do its job.
Kind of, yeah.
Yeah.
This can happen with things like exocrine pancreatic insufficiency, EPI, where they lack digestive enzymes, or conditions like diabetes mellitus, where sugar transport into cells is messed up,
Okay.
or even simpler things like a really poor quality diet or, parasites stealing nutrients.
So the body's getting food, but it's still sending out that I'm hungry signal.
That's the gist of it, yeah. Then there's the issue of low blood sugar, hypoglycemia.
Okay.
The sources connect that to things like insulinomas. Those are insulin-producing tumors, or even accidental insulin overdoses in pets being treated for diabetes.
That makes sense. Fuel's low, gotta get more. What else do the sources point to?
Increased metabolism or just a higher energy demand overall.
Like what?
Things like hyperthyroidism, which is super common in cats,
Yeah.
just cranks up their metabolic rate. But also normal things, pregnancy, lactation, they need more fuel. Even, the sources say, being in a really cold environment can bump up energy needs.
Huh. So it's not always a disease state. Sometimes the body just genuinely needs more calories for what it's doing.
Exactly right. And then the sources also bring in the psychological or sort of behavioral component.
Like learned habits?
Yeah, learned behaviors, responses to the environment,
Yeah.
maybe constantly getting super tasty, palatable food, or competition in multi-pet homes is a big one mentioned.
Ah, fighting over the food bowl.
Right. And certain medications are noted triggers too, especially things like anticonvulsants or glucocorticoids, steroids like prednisone.
Wow, okay. So the cause could be anything from like organ issues, hormone problems, brain stuff, right down to how good the kibble tastes or who else is eating nearby. That's a huge range.
It really is quite a spectrum. And the material we looked at really emphasizes that polyphagia, it's usually not happening in a vacuum.
Yeah.
Meaning, when it's persistent, especially if it leads to obesity, or it is a symptom of something else going on underneath, it can affect multiple body systems.
Okay, which systems do the sources typically link this to? What gets impacted?
Well, they definitely highlight the cardiovascular system. Extra weight is really tough on the heart, makes existing conditions worse.
Makes sense.
The central nervous system gets a mention too, because brain tumors, especially ones affecting the hypothalamus, the appetite control center, can directly cause polyphagia.
Right, the brain's involved.
And the integumentary system, the skin. Obese animals, particularly cats, the sources note, are prone to things like dermatitis. Maybe they can't groom properly or they get skin fold issues.
Ah, yeah, the physical challenges of being overweight create other problems.
Exactly. And the musculoskeletal system really takes a beating. Overweight pets are way more likely to develop arthritis or other orthopedic problems just from carrying that extra load.
Joints under stress.
And the respiratory system is mentioned too. Obesity makes breathing harder, can worsen things like asthma or tracheal collapse. So understanding these sort of knock-on effects is really crucial context from the source material.
So it starts with eating, but the ripples can affect the heart, brain, joints, lungs, skin, pretty much everywhere. Who usually gets this, according to the sources? Any particular animals?
The material really focuses on dogs and cats. That's the primary signal mentioned.
Okay. And what might someone like you listening at home actually see? What are the signs described in the source material?
Well, the obvious one is seeing them eat more, maybe faster, demanding bigger portions.
Right.
But also that excessive food-seeking behavior, jumping on counters, raiding the trash, stealing food off plates, that's a common sign listed.
The classic food-obsessed pet.
Pretty much.
Hmm.
But here's a really key point the material makes. While, yeah, some animals with polyphagia gain weight, become obese, the sources are very clear. that pets with serious underlying medical issues.
Like the ones you mentioned earlier, pancreas issues, diabetes.
Exactly. Those pets might actually be thin or even losing weight despite eating like crazy.
Whoa, okay, that's really counterintuitive.
It is. In the source material, make sure to point that out specifically.
So eating a lot but losing weight, that's a massive red flag then, based on
A
this.
huge one, according to these sources. They also mentioned that polyphagia is sometimes seen alongside increased drinking and urination, PUPD, cats call it.
Okay.
And they specifically link that trio of signs, excessive eating, drinking, and urinating, to conditions like diabetes mellitus, hyperthyroidism, and hyperadrenocorticism, or Cushing's disease.
Got it. So excessive eating plus weight loss, or R, plus excessive thirst and urination, definitely signals something needs checking out.
Absolutely. Based on this material, the sources briefly categorize the causes, physiologic, like growth spurts, pathologic diseases, drug side effects, environmental stuff, mainly to set up how you approach diagnosis.
Right, which leads us perfectly into how vets actually figure out which of those many causes is the culprit, the diagnosis. How do they start narrowing it down according to the sources?
Well, the sources highlight that the very first step is often just careful observation. Is it really polyphagia, excessive eating?
Or something else.
Or is the pet just making lots of trips to the food or water bowl because maybe they're drinking a ton due to, say, kidney disease or diabetes? The source notes that can sometimes look like food seeking. So simple observation helps sort that out first.
Okay, step one, make sure it's actually about the food. What are the main diagnostic steps the sources outline after that?
Lab tests are really central. The sources explain that routine blood work like a CBC and biochemistry panel and urine test give a ton of clues.
Like what kind of clues?
Well, they talk about looking at white blood cell counts, for instance. Certain patterns can hint at things like Cushing's disease or inflammation.
Huh. Blood cells pointing to hormones. Interesting.
They can give hints, yeah.
Yeah.
Blood sugar levels are obviously critical. The sources really emphasize this. High sugar points towards diabetes, maybe certain tumors, Cushing's, whereas low sugar is a strong sign of an insulinoma or an insulin overdose issue.
Okay.
They also look at things like cholesterol, liver enzymes. These can be elevated with metabolic problems like diabetes or Cushing's, or sometimes due to medications.
So that standard blood panel is already giving a lot of potential leads. What about the urine tests?
Urinalysis is vital, especially for screening for diabetes. The sources point out finding glucose, sugar, and maybe ketones in the urine, plus changes in urine concentration. That's a really strong signal for diabetes mellitus.
Right, makes sense. Too much sugar in the blood spills over into the urine. Are there more specific lab tests the sources mention for nailing things down?
Oh, yeah. These are tests designed to really zero in on specific conditions. A fecal exam is listed, standard check for parasites that might be messing with nutrient absorption. The sources mentioned a specific blood test called serum trypsin-like immunoreactivity, or TLI, that's used to diagnose that pancreatic enzyme deficiency, EPI, we talked about.
Specific test, specific problem.
Exactly. For thyroid issues, particularly in cats, the sources talk about checking total T4 levels in the blood. For Cushing's disease in dogs, they describe tests using dexamethasone or ACTH stimulation. These evaluate how the adrenal glands and pituitary are functioning.
Okay, more hormone testing.
Right. And if that low blood sugar, hypoglycemia, is found, testing serum insulin levels is key to look for an insulinoma. So these more targeted tests, according to the source material, are crucial for pinpointing many of the underlying disease causes.
Beyond blood and urine, what about imaging? Can they actually see the problem sometimes?
Yes, imaging often plays a big role in visualizing organs, just as the sources describe. Abdominal ultrasound is really useful. Well, vets can use it to look at liver size, check the adrenal glands, are they enlarged, there's a tumor. They can examine the pancreas for masses like an insulinoma, or look at the intestinal walls for thickening that might suggest inflammatory bowel disease.
So ultrasound gives them a good look inside the abdomen.
A really good look, yeah. And for those, rare cases where a brain tumor affecting appetite is suspected, the sources do mention that advanced imaging like an MRI might be needed to get a detailed view of the brain, especially the hypothalamus.
Okay. Any other diagnostic procedures mentioned?
The sources include endoscopy with biopsy.
Going in with a camera?
It's essentially, yes. It lets the vet directly see the lining of the stomach and intestines and take small tissue samples if they suspect something like inflammatory bowel disease is causing malabsorption and maybe contributing to the hunger.
Okay, wow. So we've covered the huge range of whys and the pretty detailed process the sources outline for figuring it out. What about managing it? How do they suggest treating polyphagia?
Right. So the source material makes a really critical point right up front here.
What's that?
If an animal is eating excessively, but they're losing weight, or just staying stubbornly thin, it's highly probable there's an underlying medical issue.
The red flag we talked about.
Exactly. And in those cases, the sources stress the pet must be evaluated by a vet to find and treat that cause before anyone even thinks about restricting their food. You could make a genuinely sick animal much worse otherwise.
That makes total sense. You have to fix the underlying problem first.
Absolutely. Connects right back to the diagnostics. So once any underlying medical cause is identified and being treated, or if the excessive eating was maybe due to simpler things like diet or behavior without a disease, then the sources outline management strategies.
Okay, what are those?
Pretty much what you might expect. Limiting the total amount of food, often switching to a reduced calorie diet if weight gain is an issue, and increasing physical activity.
So the basic principles of weight management kick in then.
They do, but the sources add some really practical details. They absolutely stress that owners must accurately measure the food. No guesstimating.
Right, portion control is key.
Totally. They suggest tactics like adding low-calorie bulk. The classic example for some dogs is canned green beans to help them feel fuller. Feeding smaller, more frequent meals is another approach mentioned, as long as the total daily calories stay controlled.
Keep them feeling satisfied more often, maybe. Any other clever tricks mentioned in the source material?
Yeah, a few. Removing the pet from the dining area during human mealtimes helps reduce begging and sneaky snacking.
Good idea.
Using food dispensing toys is another one. Makes the pet work for their food, slows down eating, and gives them some mental stimulation too.
Oh, that's great for those dogs that just inhale their bowls in seconds.
Exactly.
Mm.
And for dealing with competition in multi-pet homes, the sources advise feeding animals separately, maybe even in different rooms. And for cats, providing multiple feeding stations can sometimes help reduce conflict.
These are really practical, actionable tips. Does the material give any guidance on how much food is right?
It definitely emphasizes calculating the appropriate calories needed. It notes formulas exist as tools, for instance. It mentions the common resting energy requirement formula, like 30 times weight in kilos plus 70, as a starting point. It highlights that precision is important.
So getting the numbers right.
Yeah. And using appropriate chew toys is also suggested, as a non-food way for them to satisfy chewing urges.
What about using medications specifically to control appetite?
The sources are pretty clear that the main treatment is always aimed at the underlying cause. If the polyphagia is a side effect of a drug the pet needs, then maybe tapering or switching that drug, if possible, is the first step.
Okay.
For cases where it seems like a compulsive eating behavior, sort of psychological, the sources do mention specific medications like clomipramine or fluoxetine antidepressants. Essentially, that might be prescribed for dogs and cats.
So behavioral meds are sometimes an option?
They are, in certain situations. And the sources also mention a specific drug called durlotapide, which has been used for obese dogs.
How does that one work?
They describe its mechanism as affecting fat absorption in the gut and also triggering the release of a hormone, peptide YY, that signals satiety or fullness to the brain, decreasing appetite. It requires careful veterinary supervision, specific dosing, and adjustments.
Well, that's a pretty targeted approach. Finally, what about follow-up? And are there potential complications the sources warn about?
Follow-up is definitely crucial. Monitoring the pet's body weight and overall condition is key, especially if weight management is the goal. And the sources note, monitoring owner compliance with feeding plans is important too.
Making sure the plan is actually being followed, and what can go wrong? What are the complications?
Well, the obvious one listed is obesity itself, if the eating isn't managed. The sources also specifically mention owners giving in to begging as a complication because, well, it undermines the whole calorie control effort.
The puppy dog eyes are powerful.
Aren't they just? And if there's an underlying disease that isn't treated, the complications can be severe weight loss, even emaciation, despite the huge appetite. And for obese pets, the material circles back to the worsening of those related health problems. Respiratory, cardiovascular issues, joint pain.
Right, the knock-on effects again.
Yeah. This whole deep dive, it really shows that eating too much in a pet,
Yeah.
it's rarely just about them being greedy or having bad habits.
It's much more complex.
Way more complex. Understanding these details from the source material really gives you, the listener, incredible insight into what might be going on. It helps you observe your pet more effectively, notice potential signs, and just have a much more informed, productive conversation with your vet to support your pet's health.
Absolutely. We've seen how this excessive eating can come from such different places.
Mhm.
Hormone issues, organs not working right, stuff happening in the brain. But also, just as easily, from simple things in their environment, like how tasty the food is or who they share a house with. This really intricate picture, painted by the source material, underlines that polyphagia isn't just some simple behavior, it's often a symptom, a signal emerging from this complex interplay between their physical health, their psychological state, and their environment.
Well said.
So thinking about that, what does this deep connection between body, mind, and the external world really suggest about health and behavior more broadly? Not just for our pets, but maybe even for us too.